क्लिक करना।
Good evening. Is not working. Good evening. First of all, thank you again, Viadyas for a very nice and informative session. In fact, I was also never wanted to interrupt or disturb you, but sorry, actually, we have one of our guests today from straight away from USA, Dr. Asha, and she joined us today. I will tell more about her in the session. And we have some other meetings, so maybe you can continue listening to Viadyas after this as well. And I think tomorrow also he is available at Chaudhary Brahmprakash. I think that is also getting planned. And he has already developed certain sessions on our platform. And we are in discussion that maybe on regular basis he can come to our platform, that is Indianvaidyas. So we can have more sessions and we idolize you. I don't know if you have seen that web series Physics Wala. So you are a kind of in Ayurveda. So please continue this journey, and we are with you in many aspects. Thank you. So first of all, I thank Dr. Miley, right, if I am pronouncing right, and thank you for this opportunity. Thank you, Dr. Sandesh. I think we connected at the time of COVID, if I remember, and he was having a patient in Gurgaon. So what Anuj Jainji was doing in the entire India, we were also doing in some parts in through the digital medium, as well as I think that is the way we got connected as far as Ayur emergency Yathra is concerned. So I will start straight away, come to the point. Don't worry, I will not show you all these documents because I stopped showing all these documents before after realizing that there are many other ways as well. So on one side we have an encyclopedia in the form of Viadyas. So definitely he will keep on going and going and going. But we need more Viadyas like him. So our ideas and my session will be to create that aspect to the entire community who is listening to us right now in this auditorium. And digitally, I think we are being live to the entire globe. So we enjoying nice followers as well. So your session today from the morning, I think, is streaming live on our platform, and we'll be taking it forward from here. So I will quickly come to the point of emergency care, and if you talk about emergency care, I think pain or acute pain is one of the most terrific situation, or sometimes most pathetic situation that you are not able to get healed. And on the cost of healing, if you are getting, I repeat, on the cost of healing, if you are getting another issue, another health issue, some kind of an addiction, some kind of a side effects, so that is not acceptable. And you talk about all the leading painkillers of the world, by the way. Just Google it, just do it, ChatGPT, whatever you want to do. All the top 10 or maybe top 5 best painkillers of the world, and I go this on record, are either opioids, naturally derived or synthetically derived. You can check the best painkillers. And if you remember, Afim and opium is there in Ayurveda. So I came up with that background today in this session, that everything has been derived from here. And how, like we were talking about some colonization in the previous session. So let's see quickly in this presentation today. I'm not able to get to the next slide, please. Is there an issue? Yeah, thank you. So I will start with some testimonials, although I will not bore you with the before and after thing because already it's lot. The ज्ञान का सेशन इज लिमिटेड होना चाहिए, थोड़ा सा माइंडसेट को भी समझते हैं और थोड़ा सा एंड प्रोडक्ट को समझते हैं. So you should have these kind of testimonials because most of you are students or maybe starting your practice. So I come on that aspect as well. When we establish a private practitioner in Ayurveda, you need testimonials. One side these case studies to be a researcher. Another side like me that maybe I am a researcher but not that much, but I am a clinician and I have to be a successful clinician. And the result of that is the testimonials. So you can see one patient, and due to this patient, first time I did consultation in Islamabad, Karachi, Lahore. So I had so many patients from Pakistan because he is a Pakistani situated in Toronto, Canada right now. And you can read that he was suffering from the disease exactly is Parkinsonism, and he was suffering from movement disorder. He was not able to move, and I think you all are aware about that Parkinson gait and the person who is suffering from Parkinson, how they can get disabled in terms of doing their day-to-day life activities. And he was like that only when he connected us. And after a few months, he was able to exercise. He is going gym, and the doctor who was treating him, she was very surprised that how you are doing this and what is the secret. And in first time in my life, I am seeing that Parkinson case is reviving too fast and too good. Like you are driving to me now, like all these things. So he discussed that there is one doctor in India and he is giving me some, and the formula is Yathra, Chintamaniras, Yogendras, simple treatment protocols. I am a very average, by the way, in terms of you can medical cannabis, you see these kind of results. And this is entire science. See, Ayurveda has mentioned thousands of years back about these plants. I will show you in the schedule even list as well today. So this is an ideal case of Ras, Shastra and medical cannabis. If given in combination, we can even reverse Parkinson. And this case is now getting submitted to the Parkinson Society of Canada as well with our treatment protocols. Now there are certain other reviews and all, so I will not again go in detail. My point is, in this, I think, it is not visible, right? So I'll just highlight. So there are cases like 90% cardiac artery blockage. 90% means, जैसे डॉक्टर साहब बोल रहे थे ना. So if he can revive. There are patients in acute migraine. So migraine is so acute that daily they have to take painkiller and sometimes injections. That is an acute stage of migraine. After taking 3-4 tablets at a time, still they are not able to get healed in migraine. And within few days, the pain get reduced. Their allopathic medicines, so first they say that they can get rid of, and at least 6 to 8 months after treatment, the migraine can also be revived. And very simple treatment protocols, not that much. And we are doing all these trainings live on our sessions also regularly. So chronic pain issues and all these issues are there. And again, so this is again a very interesting case. The top one, the bilirubin was 42. So first time in my life, I got this case that they were just going for liver transplant, and so they were just going for liver transplant, and somebody referred us कि एक बार चले जाइए 25 लाख का डॉक्टर साहब package has been decided in a private hospital in Delhi NCR, but we just thought कि, so I said okay, you can wait for 2-3 days. So they said yes. So I said okay, let's start Ayurveda and let's see if something will start getting healed, and let's see the results. And after a few days, I think he has written this review, and it was around 5, and he is working fine now, and no transplant required, and the entire liver has been revived. And liver is the only organ in our body, I don't know if you are aware about, that if it is reviving 10% also, now it can revive. The entire liver can revive. And it is written in our Shastra as well, by the way. So 5% का तो नहीं पता, कि 10% is there. You can think of that you can revive the entire liver with good Ayurveda treatment protocols. It's so simple, right? And we are doing all these trainings, by the way, and we have recently decided there is one feature in Instagram. I don't know how many of you are. So there is a broadcast channel we have started now. So we will not be putting anything on the social media, because in Ayurveda people like start taking themselves. So this is under strictly under the Viadyas only. So all of you are Viadyas, you can join that broadcast channel, and we'll keep on posting each and every treatment protocols and details in that, and you can have a discussion with us on that. And you can see that all these cases were suffering from sometime chronic, from last 15 years. This is a case of respiratory system and asthma was there from last 15 years, and in the third visit only, they have documented that it has been 70% cured. So these kind of cases, as we are seeing in our clinic, and we are able to see that all these cases are getting healed. Now the last review, it's not that much in the case was very simple, but it was my myth spread by Britishers. I want to just focus on this one line of this patient, that he realized that following allopathic system of medicine and always thinking that allopathic system is better than alternative system was my negative thought process, which has been developed by the Britishers. Now I understood that after getting healed by Ayurveda. So unless or until they will not experience it, they will not realize that. Until unless in your homes you will start throwing allopathic medicines and you have first aid boxes of Ayurveda medicines. Unless or until you are not giving your kids antibiotics and you are giving them ras aushadhis when they are you are not giving them antibiotics. Also, you are giving them ras aushadhis when they are getting viral infections, sore throat. You are giving them herbal cough syrups. You are not giving them any anti-allergic tablets. You are giving them again Ras Shastra or maybe some churnas if they can take, or some at least herbal decoctions or syrups or swanprashanam. So these kind of practices you have to follow in each one of your home, and then you can think that yes, let's practice emergency medicine in Ayurveda. Point number 1. Second, how many you have not taken any kind of allopathic medicine from last 1 year or 2 years or so? Great. So that kind of level you have to create within yourself first. Charity begins from home. And if you are taking any medicine or if you have to take any medicine, please consult your seniors, juniors, or maybe anybody who is practicing in that zone, that for this what should I take, or maybe as per Doctor, if you are lucky to get a Vaidya like him, he can treat you from the root cause. So you are not supposed to take any medicine, at least for lifestyle disorders. Okay, so let's understand about acute pain now today, and many other emergencies. Only just focus on this list. Very very simple. Syllabus out. आज पेपर लीक हो गया है. Whatever you want to say, acute cases को handle करना है, emergency medicine को handle करना है. Please focus on this list. Please only focus on this list to start with. Your first line of treatment, your drug of choice, without any fear, without any hindrance, without any doubt, without any confusion, should be from any of this at least. If you want to be successful in acute pain management or any other pain management or any other emergency medicine. This is schedule E1, and the number 1, the first one, Ahifena, right? Ahifena, again, if you, as I started, if you see all these potent painkillers are either from Ahifena or derivative of Ahifena. I repeat. Let me put it like that only. So these are Ahifena derivatives or medicines from Ahifena, which has been labeled by our so-called fraternity in pharma and medical and allopathic, and now they are the leaders in terms of acute pain management. And we are just sitting and thinking, oh, is there any medicine in Ayurveda which can heal pain within seconds or minutes or hours? In fact, our Marma specialist can heal your pain in seconds. Our Agni Karma specialist can heal your pain in seconds. We don't need always medicines, by the way. It's just that if you don't want to do Marma or you don't have an access to a learned Marma professional, it's just if you don't want to do Agni Karma or you don't have any access to a good Agni Karma practitioner, you can at least have medicines. You can at least have oils. You can at least have those balms which can heal your pain immediately. I challenge, faster than any chemical solution, put it to us, and we can challenge that we can heal your pain faster than that. And take that challenge, each one of you, join us, follow us, be in our broadcast channel. You will get to know for each and every medicine, and few examples I will share today as well. Right? So that confidence you need to build in yourself, like Vaidya Anuj Jain ji is practicing. That confidence should reflect in each one of you, and it's very, very, very simple. Take any medicine from these categories and you will get to know. Simple as simple. So the homework is, whosoever are listening, at least understand first of all कि in classical yogas में these ingredients are, in proprietary medicines में these ingredients are. In which proprietary medicines, we never see ingredients in the proprietary medicine. Oh, they have written syrup needy for renal stone. Chalo, let's start writing syrup needy for renal. What exactly is there in this combination? Maybe he is writing needy for some patient, but maybe he is writing ural or maybe some other proprietary medicine for some patient. I also recommend proprietary medicines, but at least give some thought process according to their ingredients. Don't just blindly follow the brands. You can practice proprietary, by the way. In urban population, in cosmopolitan population, if you have HNIs or ultra HNIs patients of the world, you have to practice proprietary medicine. Especially in North India. In West and South, still people can have rhythms, kashayams. But nobody will take in my city. At least. In my last 17 years of career. They always prefer sweet syrups, tablets, capsules. Maximum they can have some palatable powder as well, like Hingvashtak or Lavan Bhaskar, but not Pansakar. They will puke. So what should I do? I'll stop doing Ayurveda practice or I will adapt myself. Right? So let's quickly understand this list, and this list in Ayurveda is also contains the Rasa Shastra, by the way. Mercury, Parada at 18 number. So the entire Rasa Shastra is Schedule E1, means you cannot prescribe any single ras without an Ayurveda doctor. I repeat, and each and every ras is getting sold online without any prescription. You cannot buy cetirizine from 1mg.com without a prescription of an allopathic doctor. I repeat, you cannot buy cetirizine from 1mg.com without an allopathic doctor prescription. Try it today. But you can buy any Ras Shastra, any Ras Yog from 1mg without an Ayurveda doctor prescription. Why so? At least complain about them or request them to add that feature that these medicines are Schedule E1. At least get a prescription first to dispense it from your website. Simple, and we all need to raise this. We have raised this several times, several websites have been corrected, but all of you have to raise this as well to get your status back. That yes, this is our Schedule E1, these are our prescription medicines. These can be life-threatening as well, by the way. There are certain vishas. These can be life-threatening and these can kill you also. Mind you, these can kill you also if you are not taking under a medical supervision of an Ayurveda doctor. This has to be taken under an Ayurveda doctor and a Vaidya only. Simple, period. So nobody can take any ras or any. किसी ने डॉक्टर साहब का वैद्य जी का वीडियो देखा, अच्छा वैद्य जी बोल रहे थे लोके चिंतामणि रस काम करेगा. सॉरी टू से दिस ऑन सोशल मीडिया, एनी लेमैन. चलो लेट्स गेट त्रिलोकी चिंतामणि रस. भाई कोविड हो गया, उसको त्रिलोकी चिंतामणि रस दे दो. वो वायरल भी हो गया था बॉस वीडियो, एंड आई थिंक उसको मिनिस्ट्री ऑफ आयुष हैज टू रिलीज ए सर्कुलर दैट दिस इज नॉट ए मैजिक ड्रग, डू नॉट promote this. वो पूरा एक सर्कुलर they have released on social media about त्रिलोकी चिंतामणि रस. I remember that. So that is the issue with Ayurveda. But at least if that is a check that they have to get through prescriptions only, then at least we can focus on these contents, and these contents are very, very important, and same is in Siddha and in Unani as well. Now just very interesting point. Just read this. This is a British medical journal publication of 1884, and the topic is therapeutic action of Indian aconite. In 1884, one Britisher recognized that there is an Indian aconite and there is a therapeutic action of that. Now the second paper. 1843, 28th January 1843, it has been published in British Medical Journal again. Preparations of the Indian hemp and ganja. So they were aware in 1843 that how important this plant is. And they are now coming back to the square one. I will show you in the further slides. But why I have showed this to you? These two are the ingredients of Schedule E1. The list I have just showed to you, Schedule E1. These two plants are, and there are so many other BMJ publications of 1800s, where they have published about Ayurveda, herbs, and they have just taken everything from here. They have infused their fortifications and their form of derivatives either in the lab or in the nature, and they have just labeled the entire ecosystem to their name and to their credit, and we are just sitting idle and just understanding what is going on. You can see the list. So this is WHO list for analgesic management, and you can see the first step is NSAIDs, and the second and third step all are opioids. Hydrocodone, codeine, tramadol, morphine, methadone, phenytoin, oxycodone, everything is opioids. WHO in 2023 April is saying that if you have to manage any kind of acute or moderate pain, only opioids are the solution, right? And opioids are a fiend, by the way. So Ayurveda told this 5,000 years back, but in limited quantity, but under medical supervision. But still, Ayurveda has the better solution. Why? Because there is an opioid crisis right now in US. I don't know how many of you are aware about this. Very interesting. On one side, WHO is saying that everything has to be managed by opioids, all your pain. And second, opioid crisis. It's not, by the way, joke. Thousands of people are dying due to this, and in fact in India also the US drug makers are pushing painkillers. All of you can purchase Ultraset. All of you can purchase any painkiller, in fact without prescription also. Why? You can go to chemist shop, you ask Ultraset, he will give you without prescription. What is Ultraset? It is a synthetic opioid derivative. You can get, anybody can get that. Any case you are seeing in your clinics, itne saalon se doctor sahab, we are just having that. Painkillers are like OTC. Daily basis pe pop in. What is the side effect? You are getting so many side effects. And this is the latest one. So see, ultimately I want to make a point here. At the extreme level of pain management, they only have opioids. We have so many medicines which I have just shown you in schedule even. I will explain for one hour in just few minutes. I have 15 minutes more. Point is, we need to focus. We need to focus on our Shastra. Everything is there. If you read Ras Shastra, it's beautifully written. It's very simple. Please understand each and every rasa. Please understand each and every ingredient which is there in schedule even, and you can manage most of the cases of emergency medicine with that. Definitely, Panchkarma, Kash Oshadhi, all the other karmas are important. Definitely, in anorectal, I am saying Shar Sutra is good, but still you have to make your levels, and you have to understand at what level you are practicing, and also understand the science. See, on one side, Vata Kaf, Saptadhatu, Srotas, everything is very, very important to us as an Ayurvedic doctor and Vaidya. Now, but we need some Vaidyas from our community to understand. That's why I am just intentionally doing this session in English, because each and every Vaidya who is sitting in this auditorium or listening to this broadcast, if you are not able to understand English, अगर आपको English समझ में नहीं आ रही है तो please बहुत सीख लीजिए. This is the time that we have to learn English, to understand English, to speak fluently in English, so that the world can listen to us and they can understand. But we want to make it to the point now, because it's high time. So all of you should understand this, and all of you should also understand that when you are having that mindset, please also understand their fundamentals. Please enter into their ecosystem. Attack is the best self-defense. So unless or until you are not understanding their ecosystems, you are not understanding their language, you are not understanding why opioids on one side are one of the best painkillers, still damaging the body, still getting us addicted, still killing people. But on one side there is an option in form of cannabis which has not killed a single person till now in the entire world. So what is the difference between the mechanism of pain management when we are giving? Cannabis is also deadly, cannabis is also threatening if it is at the recreational level, but if it is at a medicine level, it can heal. But how cannabis is healing and how opioid is healing? That fundamental, unless or until we are not able to understand, and we are not able to understand that how it is any of our herb, how it is getting penetrated to their pharmacology or to their pathology, and then it is giving the results. So if we are not able to speak that language which they understand, we are not able to communicate. And if there is no communication, there will be no integration and there will be no cooperation as well, by the way. It's very, very, very simple. So you need to understand first, you need to learn. हमारे लिए double पढ़ाई है. So we have to study two pathies. On one side we have to study our Ayurveda, on the other side we have to study pharma, science, medical, whatever you want to study as per your understanding. But please study, please understand these mechanisms. I will not get in detail today, but please understand these mechanisms. If you are not able to understand these mechanisms, you are not able to talk in that language, then only your entry in ICUs and allopathic hospitals will be easy. By the way, when I talk with all these medical oncologists and the top onco people in our country, because we are practicing medical cannabis, they understand that this person also understands our language. I can understand TNM factor, I can understand at what level your case is, I can understand that the highest level of opioid analgesics you are giving, but still you are not getting that pain control. How then cannabis can help them? How that can be improved in terms of quality of life? How Hiragvasam can help them? By the way. So that language you need to speak with them, and the more you start speaking that Hiragvasam or Swarnvasam in nanoparticle form is doing this to the cancer cells. Simple. And then they will understand and they will accommodate you, by the way, in their practices as well. And jahan nahi mane, wahan pe वैद्य जी की approach. I really like your approach, by the way. Authoritative. Great. So pain are again three types of pain. I will not again get in detail here, but all these three types of, my point is, all these three types of pains can be healed with that list that is Schedule E1. Simple. We can connect and we can correlate each one of them with each one of the herb which is mentioned in that list, but in a nutshell, it can be. And if you talk about acute pain management in Ayurveda, either follow Schedule E1 or at least combine that with Rasa Shastra, or you can be an excellent Marma expert. If you are really an excellent Marma expert, you can manage acute pain within seconds. If you are an Agni Karma expert, you can manage pain in seconds or minutes. Acute pain, I am talking about acute pain only, by the way. So these are your options and modalities, and definitely Panchkarma. If you are an excellent Panchkarma expert, you can always manage that. Acute as well, I have seen. Immediate Vasti Chikitsa, I have seen. Just immediate on emergency basis, if you are giving Vasti Chikitsa, it can heal with tremendous speed and with tremendous dynamics if the person is well versed and trained. So these kind of modalities are there in our country. You need to understand and you need to accommodate. And like myself, I am very fond of Rasa Shastra, by the way, and I practice Schedule E1. So that is my choice or my expertise, you can say. I am not a Marma expert. I can't be. I am not an Agni Karma expert. I can't be. I should not be, by the way. So this is a time of segregation. I respect all of you, but I request all of you as well. Please segregate. Please segregate into something very, very specific as you can. Then only our community will grow. Then only we will grow, and then only we will be able to fight with this cruel world of other cartels and other businesses of the world. So please segregate. Please specifically go and see the models like in Pune. So there is an ultra specialist in Pune. Is also decreasing the opioid treatment as well, by the way. 40% reduction in the opioid addictions have been reported where these have been medically approved. And you can see again 80,000 Americans are dying from opioid overdose and they have died in 2022. Again, the disclaimer is we are never promoting any recreational. Hemp seeds and hemp seed oil are under FSSAI right now in India, and hemp leaf powder and extracts are approved by state Ayurveda approval authorities in Madhya Pradesh, in Uttar Pradesh, in Odisha. It has been approved. So all whatever we are quoting here today at this premises are under regulated aspects, and these are not under the purview of NDPS Act, by the way, and we always strongly oppose and discourage any recreational usage of hemp, and we also strongly oppose any unethical practices. And I think ये photo आप में से पता नहीं कितने लोगों ने देखी होगी. So there was on channel News 24. मीडिया एक काफी important role play करता है हमारी सोसाइटी में, and we were been there, and by the way neither Dr. Anuj Jain nor me has paid anything to this channel. So there are paid PRs, but this was real story, and I think you are aware about your director, Dr. Tanuja Nesri. She was there in this story. Patanjali model was there. AIIA model, by the way, they started with the All India Institute model of COVID, and they covered then Patanjali, then Anuj Jain ji was there, I was there. So this story was crucial enough to break that dilemma that Ayurveda can also heal as far as the emergency. Because prior to that, so many stories were there, but they were talking about some there were some our fellow doctors were sitting in those panels, but they were only talking about kahas of the world or certain other therapies of the world, but nobody was talking about emergency management in COVID. Nobody was talking about Raj Shastra. I got frustrated a couple of times during the some ministry events. Also, I posted that why not we are not promoting Raj Shastra? Why ministry is only promoting Kashayam and all? But again, with due respect, they understood and then they released the entire protocols of Raj Shastra and everything as well. Because initially everybody was also confused. So I think again, thanks to ministry that they realized this potential and in their advanced level of protocols, entire Raj Shastra is now included in the COVID management as well. So that is again an achievement you need to understand, and that was the story where the perception also changed. And on India Today also we have been featured a couple of times, and it has been documented very well that again the entire list should be there. So you have to understand Schedule E, you have to maintain prescriptions and all. These are not under NDPS Act. Only other doctors can prescribe, by the way, and prescription is mandatory. And we have filed an RTA also that it is again not under NDPS Act. I will not go in detail in these mechanisms, but again these are very important mechanisms. If you can understand, then only you will be able to get rid of this dilemma that how to practice and when to practice, and reduction in opioid usage also there. And I have written a book as well, by the way. Anyone of you is interested more in medical cannabis, you can order that book from our website as well. But just to understand that reduction in opioid usage has been documented, and then in cancer also it has been documented that quality of life is improved as far as this cannabis herb is concerned. So again, in the final statement, I want to conclude, and I think I have concluded on time, 10 minutes prior to my slotted time. So I want to conclude here with these three aspects which you need to understand as a Vaidya and a doctor. First of all, if you talk about acute pain can be in any form. It can be your local musculoskeletal system. You can have good rubs, balms, roll-ons or oils these days, having these as ingredient. For example, Mahavish Garb Tel, having Strucnus nix vomica, the kuchla is there in Mahavish Garb Tel. That is one key ingredient which helps in reducing the pain with immediate effect, the localized pain. Same applies to cannabis as well. So in acute pain, either you have an acute headache, you have acute migraine, or also is acute abdominal pain sometimes. For females, there are menstrual cycles, and also you have acute abdominal pain, and they are immediately popping up either a chemical pill or taking an injection. Rather than that, either first start with localized approach and then at least give them either good quality medical cannabis medicine as per approvals of Ayurveda, 50 mg to 75 or 100 mg depending on their body weight. So the dosage is as per the body weight, and we have a detailed session on dosing as well. Or combine that with any Raj Shastra medicine if you know the pathology of the pain. So there are two aspects. Either you know the pathology of the pain, or that thing on the day one or the first instance, the reporting was acute pain. So many times it can take some time for you to understand what was the reason, but at least you need to get the patient relief from the pain within sometimes seconds or minutes. So localized approach, internal medications. Then if you know Marma, you can do Marma. If you know Agni Karma, you can do Agni Karma. If you know Panch Karma, you can do Panch Karma. That is the additional approach with that aspect, right? Third thing here is, see, in acute pain management, you need to understand one more thing. See, there are localized pain, then there are pain in terms of the internal organ. For example, if you go through the vital organs, so that the renal calculi or the colic pain is very, very sometimes acute, and sometimes patient needs immediate intervention in terms of highest level of painkiller. Again, if you have medicines as per your experience that can immediately act as a good diuretic and can also start reducing that particular stone within minutes of the administration. Otherwise, you have to give them either herbal painkillers, which I have clearly mentioned as far as the medical cannabis or Raj Shastra Yoga are concerned, and then immediately start that diuretic also. So that pathologies you need to understand if you get an episode of acute pains in the abdominal region. I can talk in length, but I have a limited time, so we can extend this session on our platform whenever as far as the acute pain management is concerned, because for each vital organs you have to think from the Ayurveda perspective as well as from the allopathic or the modern science perspective as well, that how the things are going on, and then only you need to decide and immediately work upon on your management, because it is very, very dynamic. It is not that easy which it looks like. So you have to focus and you have to understand that what kind of issue is there with that particular pain, because sometimes the neuropathic pain, you are practicing highest level of painkillers again, highest level of all these gabapentines of the world, or methylamines of the world, or all these neuropathic medicines, but still you are not getting any healing. And we are able to again get that healing, same with the Raj Shastra and medical cannabis, just because we are treating from the root cause, just because we are understanding the pathology and also getting them healed. Not only the transmission is getting blocked. By the way, the pain management, what exactly is the pain management? The pain management is on daily basis we are getting something, that will be my concluding statements in this. On daily basis you are getting something synthetically, and that is blocking your sensation of pain, period. I repeat, the pain management, the acute pain management also for some time in this entire world is maximum or is dominated by the approach that it is blocking your pathways or your overall sensations of the pain, but the reason of the pain remains sometimes there. But in Ayurveda, if we do acute pain management, we never block your pathways. We work upon, we sometimes we have to block that for some small amount of time, but simultaneously or from the day one, we work on the root cause of that pain, and then we try to heal that root cause of the pain so that your solution will be permanent. And after some time, and the entire medicines will also be withdrawn from your ecosystem. Ultimately, be it allopathic or Ayurveda, it's a medicine. So that has to be withdrawn and washed out from your system, and you remain healthy without pain. So that is the final goal of Ayurveda as far as acute pain management is concerned. And thank you so much for the time and this opportunity. And would love to connect with all of you. Thank you.
Thank you, Dr. Piyush Juneja sir, for such a brainstorming talk. The session must have been brief, but it was packed with so much of energy and knowledge. We are grateful for having you and Vaidya Anujain sir with us today. One emitting the power of Ojas and the other with the power of Agni to enlighten and boost the confidence of all of us present here today. We would like to felicitate both our dignitaries. So I would like to welcome both our dignitaries on the dais. Vaidya Piyush, Vaidya Anujain. I would like to call upon Dr. Mai Bhushni, sir.
Yeah, by the way, sorry to interrupt, we have a very special guest today as well. I forgot to introduce her as well in my session, Dr. Asha Oraskar. She is the founder of one of the leading biotechnology and purification organization of the world, Orochem, from straight away from Chicago, US. And she is also having a patent as an organization with her family as far as the medical cannabis is concerned. In fact, world's only patent without THC, that is the negative aspect of that plant. So we welcome you, ma'am, here today. And she wanted to have an experience and to meet all of you. So after the session, maybe we can have a discussion. Thank you, ma'am. Thank you.
Our Yathra is nothing if we don't have Viadyas like them. So we need really pillar to build the long way we need to go. And we decide to felicitate them for their life journey, like in the south we do with Munde. And for us, there are Prana, Bishak, Prana, Acharya. They deal with Prana, so we need them in our platform, and I hope we will have a long cooperation. We would like to have a little interaction because I know, Dr. Piyush Juneja, you are very tight in your schedule, but because you are here, we really need to have some interaction and a little panel discussion on some subjects. I would like Dr. Skantesh to come and to start the panel discussion.
So we know that the time constraint and we are running very late, but to have an idea, which actually through the Yatra we try to document some of the important perspective that the resource persons or the people we engage with in a specific kind of idea is what must be the preparedness that the Ayurveda community and professional need to be comprehend with in order to face the upcoming or the future emergencies, whether it can be epidemics like future emergencies or any kind. So we would like to get both of your specific perspective on that. What kind of the training or what kind of your vision on that? In what way Ayurveda community need to be prepared in order to face that? So these are the theme. Because of time constraint, we are just specific on that. So we need both of your perspective.
So, Dr. Sankesh, just a brief perspective in specific which aspects you want to.
Yeah, what do you think is the preparedness that Ayurveda community need put in place in order to face the future emergencies?
Okay, great, nice. So, as far as the, I think I need to come here. See, as far as the preparation is concerned, it's very simple. When we are talking about emergency medicine, it's a war, it's a yudh, right? It's a war against whatever the causative factor in that human being which is causing that emergency. It's very simple. Let's understand in that way, na? So you have to, when you are going for a war, so the preparations you have to do for a war, please understand that and do that. For example, you need first of all kavach. When you are going to a war, you need kavach. So the kavach is your learning, your training, your experience, your exposure, your confidence. If you are going for emergency medicine infections, are you protected yourself in terms of taking good rasayanas and good anti-infectives and antivirals? From last 1 month, conjunctivitis is spreading a lot in our tower, and I enjoy practice where 15 allopathy doctors are there. 3 are the top ophthalmologists, and daily each and our chemist shop owner is getting eye flu. But I was not, luckily or maybe because I practice that self enhancement of myself. So same happens with the COVID as well. I have not been diagnosed a single time in any ways, and we have in the second wave, we were dealing thousands of patients. So if I will not have my kavach, I will not be able to handle emergencies, especially in the infections. So you have to be your kavach first of all. You have to wear that in your mind. In kavach should be here, everywhere, all your indris. That kavach should be there. Second thing, you need astra. You need brahmastra. So that is the second thing. So that astra, brahmastra you have or not. If you only rely on kashta aushadhi, there can be issues. Unless or until you are super specialist in that, I don't mind. If you are from that pedigree, in some southern Indian Viadyas pedigrees, we have seen Kashta Aushadhi also being used as emergency medicine, but that are fresh, they are potent, they are sometimes enhanced, they have their own permutation and combination and formulas. If you are aware of that, please practice. But if you are not, very simple Rasa Shastra is there. No need of any dosha, dushi or anything else. Just give straight away. It is written by our acharyas. Schedule even is there. These are yours. Or you know Marma, you know Agni Karma. They are your Brahmas sometimes, by the way. But you know how to operate Brahmastra as well. So if you have that skill, so one is Astra, another is वो मछली की आंख में मारने वाला skill. So these three things are required if you want to practice emergency: your kavach, your astra, and your skill to handle those emergency or to practice those astra like Agni Karma or Marma or Panchkarma. So in any aspect, if you are weak, please make it strong and fight with confidence. Thank you.
थैंक यू. एक्चुअली आयुर्वेद में जब डिस्कशन की बात आती है तो ओपिनियन से ज्यादा कंट्रोवर्सीज आ जाती है. तो मेरा कहना यह है कि ऑल ओपिनियंस कंट्रोवर्सीज को ओपिनियंस की तरह देखना चाहिए. वी शुड सी द वन स्टेटमेंट लाइक एन ओपिनियन, लाइक एन यूनिवर्सिटी, लाइक चरक यूनिवर्सिटी, लाइक सुश्रुत यूनिवर्सिटी, लाइक भागवत यूनिवर्सिटी. ऐसे ही लघुत्रयी में जब जाएंगे तो लघुत्रयी में माधव निदान यूनिवर्सिटी. तो दीज आर एक्चुअली वन ऑफ देम यूनिवर्सिटी. ये अपने आप में एक यूनिवर्सिटी है. तो आप किसी के भी फॉलोअर हो सकते हैं, आप किसी भी गुरु परंपरा से आ सकते हैं, किसी भी टेक्निक को आप यूज करते हैं. जैसे डॉक्टर साहब ने बोला डूइंग अग्नि कर्म, सम वैद्यास वर्किंग ऑन ओनली अग्नि कर्म, सम वैद्यास वर्किंग ऑन मर्म थेरेपी, लाइक दैट. तो दीज आर द एक्चुअली यूनिवर्सिटीज. आप उसमें अपना जो देखो बोलते हैं ना, अपने खेल के ना खिलाड़ी होना चाहिए. आप जो भी करो बट अपने खेल के खिलाड़ी होना चाहिए. तो मेरा जो इसमें इमरजेंसी जो यात्रा का या हमारा जो एक आगे जाकर इसमें लास्ट टाइम मैं AIIA में गया था तो प्रोफेसर संजीव सर से हमारी बात हुई थी और एक आयुर्वेदिक ICU के बारे में हम चर्चा कर रहे हैं. वो आज यहाँ पर भी हमारी प्रोफेसर महेश व्यास सर जी से बात हुई है. आगे इस आयुर्वेद इमरजेंसी यात्रा के माध्यम से भी उसको करने की हम कोशिश कर रहे हैं, क्योंकि दिस इज द राइट टाइम टू डू. अभी समय है ये सब करने का, क्योंकि देयर इज सो मेनी रेजिस्टेंट ऑफ द ड्रग. रेजिस्टेंट ऑफ ड्रग के लिए आपकी जरूरत है और आपको रेड कार्पेट डाल के लोग बुलाएंगे, मैं बता रहा हूं. लेकिन आप इसको ऐसे नहीं कर सकते हैं कि भाई ये इस चीज का रेजिस्टेंट है तो हम इसमें अपने यहाँ जैसे बीटा, अभी मैं देख रहा हूँ बहुत सारे रिसर्चेस हो रहे हैं कि व्हाट काइंड ऑफ बीटा ब्लॉकर्स एक्टिविटी ऑफ द हर्ब्स. ऐसे कौन कौन से ड्रग है जिनमें बीटा ब्लॉकर्स एक्टिविटी होती है. तो मेरा एक सीधा स्टैंड है, जब उनके बीटा ब्लॉकर से नहीं हो रहा तुम्हारे बीटा ब्लॉकर से क्या होगा. Why should I find beta blockers and S inhibitors in herbs? तो क्लियर स्टेटमेंट मेरा जो है वो ये है कि आपको वात पित्त कफ को पहले समझना पड़ेगा. आप अपने खेल के खिलाड़ी बनो, आपको वात पित्त कफ के लिए ही जाना जाएगा. वात पित्त कफ आपको आता है तो आप कोई भी इमरजेंसी को कभी भी हैंडल कर सकते हो. इफ यू नो द एग्जैक्ट वाता पित्त एंड कफ, यू कैन टेकल एनी काइंड ऑफ इमरजेंसी एनीवेयर. बट प्रॉब्लम क्या है कि आयुर्वेद के स्टूडेंट के साथ एक समस्या है, स्कॉलर के साथ. वो चाइनीज मेडिसिन जानता होगा, वो एक्यूप्रेशर जानता होगा, वो मॉडर्न मेडिसिन पढ़ा होगा, वो और कोई मेडिसिन होगी दुनिया में वो उसको पता होगा, लेकिन वात पित्त कफ उसको समझ नहीं आता है, ना उसने पढ़ा है. दैट इज द बेसिक प्रॉब्लम. तो फर्स्ट वी नो द वात पित्त कफ कॉन्सेप्ट, देन हम कहीं से भी उसको कोलैबोरेट कर सकते हैं, उसको कंपेयर कर सकते हैं. दिस इज द एडवांटेज ऑफ द एलोपैथ मेडिसिन सिस्टम. लेकिन ऐसा होता नहीं. एंटी हाइपरटेंसिव कौन सा ये बताओ बस. ये वाली जो अप्रोच है, दिस अप्रोच इज नॉट सुटेबल फॉर अस, बिकॉज वी आर हियर टू ट्रीट द रूट कॉज. वी आर अनेबल टू ट्रीट द रूट कॉज, जस्ट गिव द some kind of medications. If you want to treat the root cause, you should treat the samprapti or pathogenesis according to Ayurveda. This is important. So, how I am treating emergency and managing emergencies and stabilize for long term? Because I am working on Vata, Pitta and Kapha only. I am not. मैंने बहुत सारे आपके एविडेंसेस दिखाए. There is मेरा कोई लेना देना नहीं उनसे. Because I thought only there is a cough, there is pitta, there is vata. So if aggressive hypertension, this is malignant hypertension. So this is due to vata only. So that's the approach. So there is, I think there is so many opinions, but we need to conclude by any platform, like we should organize protocols, at least primary protocol, at least we organize or we publish like that, or any record like that कि एक patient ARDS का आया तो first line of treatment क्या होना चाहिए? What is the first line treatment of in case of ARDS? So at least any student, any scholar opt that, and after that super consultation is there. So actually we should try to conclude and compile all the protocols, at least in primary level right now. That's useful for all youths of Ayurveda and scholars of Ayurveda also. Thank you.
But one last question to both of you, because this question we are getting, and this as a concern that we used to see in all places where we engage. That is especially regarding the current legality and ethical perspective. Since both of you are also physicians and you have treated these cases and would like to focus on that. What is the current ethical legal concerns and what can be the roadmap in order to engage with that? Yes.
Very, very good question. I think let me start and then we also contribute. And also, anyone of you wants to ask any question, I think let's open the forum also after this, because you are sitting here for so long and it's getting delayed also. As far as legal is concerned, boss, the list I have shown is the most prone for legal audits. I have been visited by narcotics 4 times, excise, audited, sometimes raided. But if I am clean in my sales and purchase, I have a valid degree. I have a valid registration in the state where I am practicing, that is Ghaziabad, Uttar Pradesh. I purchase all the medicines with bills only. I sell all the medicines with bills only. I maintain prescriptions of all the Schedule E1 medicines. I am safe. I repeat, degree, prepare a checklist. Degree, registration certificate, BMS degree minimum, registration certificate. In that state we are practicing. By the way, central registration number is not applicable. It's just a number, a cosmetic number. NCSM central register number is a cosmetic number. You have to get a state number as well in the particular state where we are practicing. Be very, very clear. They have issued a clarification also on this. It is subject to state only. This is just your listing number. This does not entitle you to practice across the India, by the way. Right? Third, your sales should be, your purchase should be with bill, your sales should be with bill. And by the way, the companies you are dealing with, check their documents as well. If they are in Schedule E1, check their licenses, check their approvals, ask them to share the copies with you, so that they are genuine. Do that, and after that, do whatever purchase on bill, do whatever sale on bill these days to the patients. If you have more than 40 lakh practice, you are entitled for GST, pay GST and grow. We do that model with all of you. So have bills, have prescription, that's it. Nobody will have any issue. You does not need any other license. Yes, but if you are dealing in narcotics medicine, specifically you need narcotics license, that you need to understand. But for the classical medicines, you does not need. For the Ayurveda classical medicines, you does not need. Your degree and your registration is valid only. Right? So know your because first time when narcotics inspector entered into my premises, he was very aggressive and he was like, he will take me to the jail. I said, boss, just sit and understand first who I am. I am a registered Ayurveda doctor. I am a practitioner. This is my degree. This is my license. These are my bills. These are my records. These are my list of the patients to whom I have given Kamniritaman Ras. Right? That is a preparation in Ayurveda having the afim. But the entire documentation was there and he was very then satisfied and happy and we had a tea together after that. So that approach and that confidence you have to build up in your practice. Nobody. Second point, and then I will give to Dr. Anuj. Second point, one jolly day, the entire CMO office team raided to our clinic that what you are doing, you have to leave your this thing, that thing. I said, well, boss, I am only practicing first of all Ayurveda. I am not practicing any single allopathic medicine. So if you are only practicing Ayurveda in your state, you are supposed to register to the respective district officer of Ayurveda. It does not come under the purview of CMO office. And I went to CMO office, I complained about that because they were just charging to threaten me and take some money from me, which I refused. But if you have your registration in the district, so by the way, get your registration in the district office as well. District Ayurveda officer is your local authority, so get yourself registered there also along with your state registration. I repeat, along with your state registration, if in your state this is applicable, like for example in Uttar Pradesh it is applicable that you have to get registered to your local district authority as well, which annually they renew, but that is your reporting authority in your district. So anything goes wrong, anything goes away from you, you can always connect to them and nobody can then threaten you. That entire district come under their jurisdiction. So any narcotic, excise, allopathic cannot challenge you until unless your district officer is aware about your clinic and you have been registered there. And third thing is, whenever you are practicing, you are prone to get cases, especially in the emergency medicine. You are prone to get cases, you are prone to get sued many times. So always maintain your consent forms. Always maintain your documentation written that it is not for medical legal purpose. Always have that disclaimers. Always have in written with the patients whenever you are taking risk patients that as Dr. mentioned कि पहले लिखवा लेते हैं hospital में. So if you are dealing with emergency medicine, please be clear with your, because in COVID we have learned that any point of time any patient can sue you. Be very confident about whatever you are communicating to them. Always document with consent that you are giving in their own responsibility. We have given to a patient with oxygen saturation in 40s and all the exhaustive treatments were given, antivirals of the world, hemoglobins, rifampicin, whatever, all these plasmas and all, but still patients were not reviving. So we have got that in return that on your guarantee you are giving, we don't prescribe or we don't want to. But they have written that no, we forced you to give us, then only we started. So that clear-cut communication should be there. Otherwise they will blame you, like Dr. Vaidya said. Please.
As per legal rules, there is a role of Ayush Ministry actually. But before making any rule, everything is illegal. Whenever actually there is demand and supply, we just create the demand. डिमांड को यदि हम क्रिएट कर देते हैं, सप्लाई अपने आप होगी, और सप्लाई होगी तो रूल्स चेंज हो जाते हैं. रूल्स कोई पत्थर की लकीर तो है नहीं है, चेंज नहीं हो सकते हैं. So rules are always changeable. रूल्स बनते ही तोड़ने के लिए. तो जब हम डिमांड क्रिएट कर देंगे तो रूल्स अपने आप चेंज होंगे. और आयुष मिनिस्ट्री already work on this and we also trying to work on this. What are the issues we are facing? Then there is a long work on that, need of work on long-term issue actually. But first of all, we just create the demand. Each and every patient just try to approach to you if any emergency is there. Then each and every hospital wants money only. यदि हर पेशेंट ये बोलेगा नहीं मुझे तो मेडिसिन लेनी है आयुर्वेद की, आप अलाउ करिए, तो वो करते हैं। अभी मेरिट में डॉक्टर जैन है, डॉक्टर संजय जैन, ऑर्थोपेडिक सर्जन, वो उन्होंने इंटीग्रेशन शुरू किया है, तो हॉस्पिटल में कर रहे हैं। तो देयर इज डिमांड, देयर इज सप्लाई, सिंपल रूल। मुझे लगता है कोई क्वेश्चन हो आप लोगों का तो पूछ सकते हैं सेशन से रिलेटेड या एनी क्वेश्चन। आई थिंक
जैसे ये अभी हमने सीपीआर किया, कोई पेशेंट हमारे पास अनकॉन्शियस आ जाता है और हमें लगता है कि ये कार्डियक अरेस्ट का पेशेंट है, और उसे ओरली देना भी कुछ ऐसा हमारे लिए संभव नहीं है। हम सीपीआर तो कर ही रहे हैं, बट जैसे एलोपैथी में मेडिसिन हैं, ऐसे आयुर्वेद में कुछ ऐसा हम फॉर द टाइमिंग जब तक सीपीआर कर रहे हैं और जब तक कोई हेल्प आती है हम पेशेंट की कुछ ऐसे मेडिसिन कर सकते हैं, कोई सबलिंगुअल या कोई?
हाँ बिल्कुल करना ही होता है, करना ही होता है। यू ऑल्सो मैंने एक लिस्ट दी है इमरजेंसी मेडिसिन की, और मैंने उसमें बोला है 3 किट रखी है अपने पास, एक घर पर, एक क्लिनिक पर, और एक जब भी आप ट्रैवलिंग करते हैं यू शुड कैप्ट ऑन विथ। वो किट आपको हमेशा बचाएगी, यू सेव योरसेल्फ एंड एनीवन। So there is one medication is Hemgar Potlius, but problem is there, nobody is practicing, nobody prescribing having Hemgar Potlius. You just try to find the Hemgar Potlius in any state of India or any city of India, you unable to find, मिलेगा ही नहीं। जो मिलेगा वो राजलक्ष्मी वाला है, सेवा सदन कंपनी का। So how to treat emergency? So only 2 companies making Hemgar Potlius, that is one is Dudh Papeshwar and second one is Kaleda. Dudh Papeshwar only release on to the doctor only, not market available in the market. But Kaleda delivering to the doctors also, in market also. But there is no demand, so there is no supply. Simple. So there is Hemgar Potlius. You should give Chartan or just sublingual 60 mg on per 5 minutes, on 10 minutes, like as per the severity of the disease. You can save the patient. You are able to save the patient. I am treating so many AMI patients with the Siddhamagardal and Hemgar Potlius. There is 2 medications, and third one is Malle Chandrodaya or Malle Sindur. Whenever Hemgar Potli is not responding, डॉक्टर साहब साइड ना ब्रह्मास्त्र, तो मल सिंदूर इज ब्रह्मास्त्र, इसके ऊपर कोई मेडिसिन नहीं है। आर्सेनिक कंपाउंड मल सिंदूर, ये आपको देना पड़ेगा। सेकेंड कोविड वेव में हमने मल सिंदूर से ही पेशेंट्स को बचाया, वी सेव सो मेनी लाइफ विद द मल सिंदूर ओनली। तो दिस इज द इमरजेंसी वी मैनेज, बट 72 hours ऑब्जर्वेशन इज नीडफुल। Do not put on in the house or home. Okay, हो गया है, because re-attack is, second attack is possible, and complete bed rest is necessary.
एक आपसे क्वेश्चन है सर, डॉक्टर पीयूष जी, जैसे आपने बताया था ना कि मतलब सारे डॉक्यूमेंट्स रेडी रखने चाहिए, लेकिन यदि नारकोटिक जैसे अहिफेनासत है और त्रिलोकी विजयवती मदन मोदक है, तो हम आयुर्वेदिक इसके लिए भी अलग से नारकोटिक लाइसेंस रखना होगा, क्योंकि ये तो हम आयुर्वेदिक में हमारे शुरू से ही आ रहा है।
मैंने वही बताया कि इन आयुर्वेदा classical medicines does not require narcotic license. If you have narcotics product, the proprietary medicine, then only is required. So जो classical medicines हैं, और अगर आप एक आयुर्वेदिक चिकित्सक या वैद्य हैं, तो आप सारी classical medicines की प्रैक्टिस कर सकते हैं। आप अलग से कोई लाइसेंस की आपको जरूरत नहीं है। अगर आपके पास रॉ मटेरियल नहीं हो सकता, वो अलाउड नहीं है। अगर आपके पास पैक्ड मेडिसिन हैं, पैक्ड मेडिसिन के आपके पास बिल्स हैं, तो कोई प्रॉब्लम नहीं।
ठीक है, और इनको प्रिस्क्राइब करने के लिए जैसे मतलब आपके कुछ सर्टिफिकेट कोर्स भी होते हैं, वो करना मतलब जरूरी होता है कि
नॉलेज के लिए ऐसा कोई कोर्स नहीं है। बुक्स आप पढ़ सकते हैं, बुक्स अवेलेबल हैं ऑनलाइन, जर्नल्स में रिसर्चेज अवेलेबल हैं, सेशंस अवेलेबल हैं, काफी सारे एक्सपर्ट्स टाइम टू टाइम प्लेटफॉर्म पे हम लोग लेके आते हैं। I think that is the best way, because अभी कोई structured course या as such नहीं है। I think now the universities and academies are opening up, so let's see, hope for the best। but अभी तक तो international level पर हैं, तो you want you can go international, online and all, and वो आप 1-to-1 discuss कर सकते हैं। Thank you।
सर एक चीज बता दीजिए, जैसे मान लो आप पेशेंट, जैसे आपके पास जो इमरजेंसी वाले पेशेंट आते हैं, वो पेशेंट खुद अप्रोच करते हैं या फिर मतलब आपका हॉस्पिटल से टाई अप रहता है कि ये जैसी कोई इमरजेंसी आएगी हॉस्पिटल में तो डॉक्टर आपको अप्रोच करते हैं? मतलब क्योंकि इसमें बहुत सारे, जैसे आपने बताया कि लीगल इश्यूज हैं, तो आपको क्या क्या मतलब डिफिकल्टीज का सामना करना पड़ता है?
Actually, it's a two-way practice. Two-way. Sometimes only patient relatives or patients approaches us, or sometimes hospital approaches us because of my previous work. अब जिस hospital ने मेरा previous work देखा है, तो at that time they approach us. So two-way work actually. So I think there is no problem now I am facing with emergency. If you have evidences, and actually there is no role of evidence actually in modern science, in allopathic science. So आप गिन के evidences है. Most of cases में अभी देखो ना, recurrent pregnancy loss में progesterone दे रहे हैं. Each and every gynecologist prescribe progesterone, but there is no evidence.
एविडेंस नहीं और कई बार रिजल्ट्स भी नहीं मिलते हैं.
But they simply prescribe progesterone. There is aura. There is brand. आप आयुर्वेद को ब्रांड बना दो, अपने नाम को ब्रांड बनाइए. सब ब्रांड की माया है. If you are brand, everyone you follow. है ना? अभी देखो ना, कोई भी पॉलिटिकल पार्टी होती है, there is only one leader ना. And what is the following capacity and followers? तो आपको आयुर्वेद ब्रांड बनाना पड़ेगा, आयुर्वेद का ब्रांड बनना पड़ेगा. There is some idols actually. जब तक आइडल्स नहीं होते हैं तो हमको डर लगता है. हम वी आर लकी, आई एम लकी कि आई हैव गाइडेंस ऑफ माय गुरु, आई हैव आइडल्स. तो हमने काम किया बिकॉज आई नो देयर इज समवन टू प्रोटेक्ट मी और गाइड मी. बट बाय द ब्लेसिंग्स ऑफ माय गुरु देयर इज नो नीड ऑफ, उनके आशीर्वाद से ही काम हो जाता है.
नॉलेज और स्किल और आशीर्वाद तो अपने आप कॉन्फिडेंस.
यस, तो कॉन्फिडेंस आपका आएगा नॉलेज से. नॉलेज है. अब आपने देखा है, अब हमारे यहाँ पर अभी 15 डॉक्टर्स फेलोशिप कर रहे हैं राइट नाउ. तो जब वो देखते हैं कि हम कैसे इमरजेंसी को मैनेज कर रहे हैं, तो उनका कॉन्फिडेंस तो बढ़ेगा ही ना. तो बिना कर्म अभ्यास के हम नहीं सीख सकते. प्रॉब्लम क्या है? प्रॉब्लम इज डिग्री तो ले ली, लेकिन कर्म अभ्यास नहीं किया. जब तक गुरु के पास लेके कर्म अभ्यास नहीं करेंगे, हम प्रैक्टिस इतनी एफिशिएंटली नहीं कर सकते. आप कर सकते हो जो काम आप 50 साल में करोगे, हम 2 साल में कर देते हैं. ये डिफरेंस आ जाता है, क्योंकि बहुत कुछ सीखने के लिए है जो हमें गुरु से मिल जाता है, वो हमें रेडी टू यूज मिलता है. इसलिए तो अब कोई प्रॉब्लम आती नहीं है, लेकिन जब आती है तो हम वही वाला फॉर्मूला लगाते हैं. जैसे अभी मैंने पेशेंट को जो बताया जिसको विजन लॉस हुआ था, तो डॉक्टर यही बोला कि हम कैसे दें. बोले आई डोंट नो द मेथोडोलॉजी ऑफ द ड्रग एक्शन. तो मैंने कहा आपको समझना पड़ेगा. आई एम ट्राइंग टू अंडरस्टूड, आपको समझा सकता हूं. तो वो बोलते हैं तो मैं क्यों समझूं, व्हाई आई एम ट्राइंग. मैंने कहा दिस इज योर इश्यू. तो बोले फिर कुछ हो गया तो मैंने कहा कुछ नहीं होगा, आप लिख के दो. देन ही अलाउड एंड गिव द चतुर्मुक्तस, एंड विद इन 12 आवर्स वी गॉट द रिजल्ट्स एंड सेव द पेशेंट. डिस्चार्ज इन द मॉर्निंग. ये अभी नहीं तो क्या होता, आईसीयू में रहता 3 दिन, पेशेंट एक्सेलरेट होता है उसका प्रॉब्लम्स को, क्योंकि आप बीपी को कंट्रोल नहीं कर पाते, फिर उसको कन्वर्जन आते. अब एक ही मेडिसिन से हमने बीपी को कंट्रोल कर लिया, एक ही मेडिसिन से कन्वर्जन को कंट्रोल कर लिया, एक ही मेडिसिन से हमने विजन लॉस को कंट्रोल कर लिया. तो दिस इज द अप्रोच ऑफ वात पित्त.
Just to add to this Yatra is there to understand what is the gap between the students, the Vaidya who are not, they don't feel has enough skill or enough support to practice like Brahmacharya. So how to fill this gap? So all your suggestion, what you need, this is important for us, because now we try to communicate with all the Vedyas and the policymaker, NCISM, Ayush Ministry, CCRS, to see how we can really bring this answer to be confident to act like them.
नमस्ते सर. सर जैसे आपने केसेस अभी डिस्कस करे और मतलब काफ़ी सक्सेस स्टोरीज थी सर, और टू बी वेरी ऑनेस्ट हमने अभी तक ऐसे देखे नहीं थे, बट फिर ऐसा भी होता होगा कि कुछ केसेस नहीं भी ठीक होते होंगे और अपयश भी होता होगा. डू वी हैव एनी लीगल इम्यूनिटी अगेंस्ट देम कि अगर पेशेंट वर्स करता है तो उस कंडीशन में हम लीगल इम्यूनिटीज क्या है बीइंग एन आयुर्वेदिक फिजिशियन हमारे पास?
Consent of the patient, that is important. Consent of patient है, then there is no need of any kind of issue on you. कुछ नहीं होगा फिर आपको. लेकिन कंसेंट नहीं है तो प्रॉब्लम हो सकता है और होते ही. तो आप ओपीडी में सिंपल पेशेंट भी देख रहे हैं तो उसका कंसेंट लीजिए. तो हमने उसका प्रोटोकॉल ही रखा हुआ है हमारे यहाँ. 4 पेजेस का केस पेपर है, उसके पीछे ही उसमें कंसेंट लीजिए. क्योंकि क्या होता है, अलग से पेशेंट को कंसेंट लो तो कुछ पेशेंट फियर कर जाते हैं, तो साथ नहीं देते.
और सर जैसे आपने कई चीज़ें बताई, हमें कुछ आइडिया नहीं था इसका, और अगर हम शास्त्र की देखें तो बहुत ज़्यादा कई बार हमें रेफरेंसेस मिलते नहीं हैं, तो उस आपकी स्टेज तक पहुंचने के लिए प्रोसेस क्या रहेगा सर?
एक्सपीरियंस आयुर्वेदिक योद्धा.
नहीं, मैं आपको बताता हूँ, ईच एंड एवरी रेफरेंस इज देयर. मैं यदि एक्लेम्सिया बोल रहा हूँ, उसको गर्भगत बात बोल रहा हूँ, तो उसका रेफरेंस है वहां पर. मैंने भी वहां से पढ़कर ही कर रहा हूं. मैं कोई हवा में नहीं दे रहा हूं कि कहीं से भी मेरे को लग गया. तो गर्भगत बात की अवस्था के लिए 2 कल्प आए, मैं बता देता हूं आपको. तो गर्भगत बात में यदि कफ वातात्मक अवस्था हो तो स्मृति सागर रस का प्रयोग करना चाहिए, और यदि वात पित्तात्मक अवस्था हो तो रसायन योगराज का प्रयोग करना चाहिए. देयर इज रेफरेंस इन रसतंत्र सार पार्ट 1. ईच एंड एवरी रेफरेंस इज देयर. Any kind of emergency is there, but we read, we know how to read the text. We are unable to read the text. We just chanting the text actually. So in between the lines, जो बोलता है gap in between the lines, वो सीखना पड़ता है. We try to learn how to read the text. तो हम जो वर्कशॉप करते हैं उसमें यही सिखाते हैं कि आप, जैसे उदाहरण के लिए मैं आपको बताता हूं. देयर इज वन पेशेंट ऑफ लिवर सिरोसिस विद पोर्टल हाइपरटेंशन विथ ascites with hepatic encephalopathy with coma. Okay, where to find in the text this type of reference? You are unable to find, but I give the example to you. Read the रसायन योगराज. विशेषाद कामला अपस्मारम गुद जानी. देखिए, अब मैं इसको डिकोड कर देता हूं, अभी आप बोलोगे मजा आ गया, बट अ फैबुलस ट्रांसलेशन एक्सप्लेनेशन. विशेषाद, आप जब रसायन योगराज पढ़ेंगे, चाहे आचार्य भागवत का पढ़ें, चाहे आप आचार्य चरक संहिता में पढ़ें, तो देयर इज लास्ट लाइन इज विशेषाद अपस्मारम कामला गुद जानी. अब देयर इज लिवर सिरोसिस, द कल्प ऑफ Pandu and Kamla comes under Kamla, right? Apasmaram, hepatic encephalopathy, convulsion, and leads to coma, hepatic coma, right? And अब कहाँ बात कर रहे हैं हम? लिवर सिरोसिस की. कहाँ बात कर रहे हैं? हेपेटिक एंसेफेलोपैथी और कोमा की और अपस्मार की. एंड कहाँ हम बात कर रहे हैं? गुदजानी. व्हाट इज द कोरिलेशन? एक्चुअली दिस इज द सिंड्रोम. वो लास्ट लाइन में लिखा है लिवर सिरोसिस विथ पोर्टल हाइपरटेंशन विथ ascites विथ हेपेटिक कोमा, ऐसा लिखा है उसमें. कैसे? जब पेशेंट को पोर्टल हाइपरटेंशन होता है, देन वहां पर 2 बातें होंगी. देयर इज 2 हैपनिंग, रक्तजश और हेमेटेमेसिस, इसोफेजल वेरिसिस. तो गुदजानी जब, दिस इज द फर्स्ट साइन, दिस इज द प्राइमरी स्टेज, तो वहां क्या होगा? पररेक्टल ब्लीडिंग. But we just thought perrectal bleeding है. This is not perrectal bleeding. This is due to liver cirrhosis. This is due to congestion in the liver, and this is the reverse flow in the portal vein. This is the back pressure, and it reduced by the bleeding. So this is the self-defense mechanism of the body. But we are trying to stop. What are the? We have drugs, hemostatic. दो बंद कर दो उसको. That's why Acharya said, do not try to स्तंभन in primary stage. In initial condition में स्तंभन मत करिए, just watch out. यदि वो ब्लीडिंग बंद नहीं हो रही है, देन ट्राई टू स्टॉप इट, राइट। तो अभी आया समझ में, देखो विशेषाद, अरे विशेषाद क्यों लिखा उन्होंने? जस्ट पांडु कामला बोल के निकल जाते ना, बस बिलुरुबिन, हमको इतने ही तो ट्रांसलेशन आता है, कामला इक्वल टू जॉइंटिस। What is the need to wrote like that? विशेषाद अपस्मारम, कामला अपस्मारम कुछ जानी। तो दिस इज एक्चुअली सिंड्रोम। मैं हर एक डिसीज का ऐसे सिंड्रोम डिकोड करके आपको दे सकता हूं, हर ईच एंड एवरी कल्प के साथ, और बहुत ब्यूटीफुली लिखा है उन्होंने। आपको जब पढ़ाऊंगा आप बोलोगे मजा आ गया, यही तो चाहिए था। तो ऐसा लिखा है, दे रोट लाइक दैट इन द कोडिंग लैंग्वेज। एक्चुअली डिकोड हमें करना है। और उन्होंने कोडिंग में क्यों लिखा कि कोई भी एरर गैरह नुत्थु गैरह पढ़ के कर लेगा? फिर एक्चुअली दे वांट, चलो आचार्य चरक के वंश ने इतना तो नॉलेज होगा, इतनी तो युक्ति लगाएंगे, उन्होंने तंत्र युक्ति पढ़ी है ना, तो वो लगाएंगे उसको। बट वी आर अनेबल टू रीड लाइक दैट, वी आर अनेबल टू फाइंड दिस टाइप ऑफ डिकोडिंग सिस्टम्स। अभी कब आएगा सीखने को? जब गुरु के पास रहोगे। एक्चुअली दिस इज श्रुत परंपरा। ये तो बाद में आत्रेय पुनर्वसु जी ने लिख दिया कि लोगों के बुद्धि स्मृति ह्रास होगा तो लिख देते हैं, अदरवाइज दिस इज द श्रुत परंपरा। आप सुन के उसको पढ़िए, सुन के समझिए। तो जितना सुनने में मजा आता है उतना पढ़ने में नहीं आता। अभी आप लोग बैठे क्यों हैं?
सुनने के लिए
मजा आ रहा है ना। तो श्रुत परंपरा का खेल है। तो आप श्रुत परंपरा से उसको पढ़ेंगे, समझेंगे। जब खड़े होकर देखते हैं कि इमरजेंसी को ऐसे मैनेज करते हैं, इसको कैसे डिकोड करते हैं, तो यू ऑल्सो हैव कॉन्फिडेंस। इसीलिए बोल रहा हूं, आई कैन, यू ऑल्सो कैन। उसके पीछे का लॉजिक क्या है वो हम आपको सिखाते हैं। वो कोई भी हिडन नहीं रखते ना। कितने भी प्लेटफॉर्म पर मैं गया, कभी भी हिडन नहीं रखा, मेडिसिन तुरंत बताइए मैं। तो हम चाहते तो उसको रोक सकते हैं, बचा सकते हैं, लेकिन क्यों? आपको हमें आगे बढ़ाना है, वही फर्टिलिटी को बढ़ाना है। और हम सब मिलकर अभी ये इमरजेंसी यात्रा, डॉक्टर मायल, डॉक्टर संकेश, डॉक्टर राव, हम सब लोग मिलकर यही कोशिश कर रहे हैं कि जो गैप्स हैं, हाउ टू फिल दीज गैप्स। तो दिस इज द और लास्ट में वही, जब तक आप लोग काम नहीं करोगे तब तक कुछ नहीं होगा। देयर इज नो डिमांड, देयर इज नो सप्लाई। आयुष मिनिस्ट्री का बजट देखो, बिकॉज जो आता भी उसमें लैप्स हो जाता है। वी आर अनेबल टू यूज ऑल बजट ऑल्सो। तो फिर मिनिस्ट्री क्यों बढ़ाएगी आपका बजट? प्रॉब्लम है ना। डिमांड को बढ़ा दीजिए, मिनिस्ट्री को मजबूर होना पड़ेगा। तो दैट्स व्हाई आई एम क्रिएटिंग अवेयरनेस ऑन इमरजेंसी एंड कलेक्टिंग ऑल काइंड ऑफ एविडेंसेस। एविडेंस दिया तो सबका मुंह बंद होता है। नहीं तो फर्स्ट टाइम आई एम क्रैकिंग वन सेरेब्रल हेमरेज पेशेंट केस, देन ईच एंड एवरीवन शाउटिंग ऑन मी, how it is possible? There is so many thick cranium is there. Just put the lape on the head, how it is reabsorbed? There is cranium ना। Then I find the, मैंने बोले PhD और MD वालों का काम है, मेरा काम नहीं। I am clinician। MD करते हैं बच्चे, उनको दे दो सब्जेक्ट, PhD करते हैं उनको दे दो सब्जेक्ट, एविडेंस में दे रहा हूं, बट nobody try। तो फिर मुझे ही करना पड़ा। देन आई सर्च एंड आई फाइंड देयर इज एमिसरी वेंस। दिस इज द क्लू। अभी कभी डिटेल में बात करेंगे तो बताएंगे कि कैसे एमिसरी वेन इन एंड आउट ड्रेनेज करता है वो, है ना। तो उसके पीछे का लॉजिक है, वो लॉजिक हम ढूंढ के बताते हैं आपको। फिर उन केसेस को रिपीटेडली करना, बार बार करना, तो आपकी वो सक्सेस रेट, आप ब्रांड बनते हो फिर। और आयुर्वेद खुद में ब्रांड है। अच्छा, मेरा नाम अनुज जैन है, मैं कोई हूं? नथिंग। अनुज जैन आयुर्वेदाचार्य। अब मजा आ रहा है। तो ये ब्रांड आपको मिला है, आपको उसकी अहमियत नहीं है, प्रॉब्लम ये है। तो आई एम हियर, डॉक्टर साहब हियर, डॉक्टर्स हियर, प्लेटफॉर्म हियर, all in this institution is there, all are trying to create awareness, but I am treating so kind of emergencies, that is the additional thing actually, but we are trying। आप लोग भी ट्राई करिए, सीखो और करो, क्या प्रॉब्लम है?
Yeah, absolutely right. Just to add on quickly, thank you. just to add on quickly, so the immunity thing which you have asked, so always remember the first line of communication which you are establishing to a particular patient will definitely is very important, because that is the legal foundation of a communication which you have with your patient or respective attendant. So whenever you are using words like management or maybe possible healing, that is fine, rather than if you are using words like cure or treatment or something like that, that can have issues. So always understand your communications when you are establishing in managing the critical cases, that I can whatever practice the best I know, but I can't ensure any guarantee or any kind of a treatment or any kind of a cure or any kind of a reversal for that matter. I can only try and I can only give whatever best I can. It's just we need to see how the case will respond moving forward. That's it. So that communication should be very, very specific along with the consent. That will definitely see. Ultimately, immunity is the secondary. The relationship with the patient you should enjoy. See, ultimately failures will happen. We are not gods, so we can't say we are not saying that we can manage any emergency, but failures can happen, will happen. The more it will more happen. Every day I heard a single death due to the cancer, because I am dealing with so many cancer patients. Every day one of my patients are dying, which I can't help. This is so epidemic right now in India. But at least I can, for other 10, I can prolong the duration, or I can make their pain better, or I can improve their quality of life. I can make them eat, I can make them sleep. That is the positive side of that. But the communication is established for those who eventually die also. Their relatives and their families still bring more patients to us. Because even the failure was there, the communication was not failed. So patient can fail, your treatment can also fail, but your communication should not fail. And if your communication will not fail, you will at least start growing. And the second input is, again, when you start your own practice, so as soon as you will start getting patients, that itself will start your learning again. So you have to revise and revise and revise Ayurveda till your last breath. So if you have your textbooks with you, so we have revised the entire Ras Shastra during COVID, so that we can pick up certain Ras and same maybe Viadyas and other Viadyas are doing. So you have to revise and revise each and every time, and whenever you are getting a specific case, definitely you have the reason to revise that. And when you will revise with this mindset, you will get the answer, right? So that approach should be there. Thank you.
Just concluding this very insightful and brainstorming IU emergency workshop. So just to have a 2 minutes of video documentation that has been done as part of Vishwa Chikitsa in Ayurveda. So it is done with the Padam project, which was an international project to document the snake bite healing in Ayurveda. So in this project there was an international scholar called Yamashita, and very renowned researcher Dr. Ram Manohar, and important Ayurvedic scholars and mentors like Vaidya Brahmadatta Nambudiri, Vimalandra were also involved. So we just concluding this insightful session with this presentation of this particular video.
Allora,